Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the introduction of the Lung Cancer Coaching Program. Over the next 10 minutes or so, I would like to introduce the Lung Cancer Coaching Program, tell you what's involved, explain to you the 15 guides covering 115 evidence-based therapies, and in short, explain to you why it will help you, the lung cancer patient, survivor, and caregiver. Let me begin by explaining what the Lung Cancer Coaching Program is not. It is not about lung cancer cures, silver bullet, or otherwise. Lung cancer, depending on your stage diagnosis, has dismal 5-year survival rates, and it will require you, the patient and caregiver, to understand complementary, integrative, and conventional therapies, FDA-approved conventional therapies. And frankly, you don't have that much time to learn everything you need to learn. So let's get started. Let me also mention that when I was first diagnosed in 1994 with a completely different kind of cancer, with also a very difficult 5-year survival average, I knew nothing about all these different, about financial toxicity, about caregiver issues, integrative therapies, conventional therapies, chemotherapy side effects. I knew nothing about that. Over the ensuing 20 years, I repeatedly said to myself, I wish I knew then what I know now. The Lung Cancer Coaching Program is designed to address just that concern. So let me get started. The Lung Cancer Coaching Program is made up of 15 different guides. Let me first list the guides, and then I'll briefly explain what's in each guide and why they're significant to you, the survivor, caregiver. First, conventional chemotherapy lung cancer regimens, key questions for you and your oncologist, complementary therapies, integrative therapies, lung cancer nutrition, a very important point, nutrition before, during, and after your therapies, antioxidants in cancer, lung cancer supplementation, evidence-based nutritional supplementation that's been shown to be cytotoxic to kill lung cancer, integrative therapies, as I said, evidence-based non-conventional lung cancer therapies, cannabis and lung cancer, very controversial yet important subject. Cannabis and cancer is something I'm asked about on People Beating Cancer frequently. Detoxification in cancer, mind-body, evidence-based mind-body therapies, online lung cancer support, palliative and hospice lung cancer care, and finally, 15 financial issues in the cancer patient. First and foremost, conventional chemotherapy regimens from immunotherapies through conventional therapies like paclitaxel, Cytoxan. Each and every newly diagnosed lung cancer patient will need to get a good oncologist. The oncologist is central to your therapy and your lives going forward. The key questions for you and your oncologist is they are designed for you, in effect, to interview oncologists, asking them what their experience is with your specific type and stage of lung cancer. Therapy-induced short, long-term, and late-stage side effects. I firmly believe that the side effects that I currently live with could have been largely prevented, certainly reduced or minimized or prevented had I known about these therapies when I was first diagnosed myself. You, and as an example, muscle wasting or cachexia, if you follow specific therapies, curcumin, omega-3 fatty acids, shown to minimize or eliminate a side effect which can be serious, cachexia. Antioxidants in cancer, one of the most controversial topics in cancer care today. Should the newly diagnosed lung cancer patient take antioxidants, nutritional or supplementary, before, during, or after his or her therapies? It's a very important topic for you to read. A number of studies encompassing thousands of patients over many years. Lung cancer supplementation. As I mentioned, I supplement currently with, even though I've been in remission since 1999, I continue to supplement with curcumin, resveratrol, omega-3 fatty acids, and I present studies for the newly diagnosed lung cancer patient for him or her to read in an effort for him to decide if taking these supplements can interfere with chemotherapy, can enhance therapy, or will kill lung cancer on its own. It's cytotoxic to lung cancer on its own. Very important. Detoxification, a subject near and dear to my heart. I detoxify both nutritionally and whole body detoxification. I sauna regularly. I link studies that show how whole body hypothermia can both fight your cancer as well as rid the body of heavy metals, and in effect stimulate your immune system, make you feel better. It's good for your heart. It's good for your blood pressure. Online lung cancer support. I only slightly tongue-in-cheek consider or credit the internet with saving my life. It was the internet that introduced, even in the late 90s, the therapy, the clinic in Texas that ended up putting me in a complete remission. And I do virtually all of my research on the internet, belonging to, as an example, a closed Facebook group of other lung cancer patients. You can ask any question, large or small, and tap into a host of survivors and caregivers that will help you at every stage. Granted, it's you have to take every answer with a grain of salt if it's an individual answer, reply, as opposed to a larger group. But again, closed Facebook groups, as an example, for lung cancer patients can be extremely helpful. And I'll link, I think, 4 Facebook groups in addition to a number of other groups for lung cancer survivors and caregivers. Palliative and hospice lung cancer care. Palliative care is not giving up on your lung cancer. My best example is palliative care. For me, I underwent palliative radiation in October of '96. And essentially, after experiencing pretty aggressive bone pain, my palliative radiation was able to buy me, granted not that much time, about a year, but I was able to find other therapies in the meantime, and it was palliative radiation that made the cancer go away. Basically treated the symptoms of my cancer well, so that I could find therapies that would put me into remission and enable me to live with my cancer. I do not consider myself cured. I could relapse, but it's been, I've been living with my cancer now since '94, and I'm going to keep on doing what I'm doing, and I expect to die of old age decades from now. Last but not least, a very difficult topic for everyone, the financial toxicity of cancer diagnosis. Basically, everything costs money, whether it's scans, blood tests, certainly chemotherapy, even if you have excellent health insurance. Co-pays and deductibles surely will add up, especially if you're on expensive immunotherapies. Even 10% monthly can be a crushing expense. The single greatest reason for personal financial bankruptcy in America today is a cancer, is a medical diagnosis. It's critical for the lung cancer patient to be aware of how your hospital works, perhaps finding someone at the hospital to help you with billing, to understand how much things cost perhaps before you undergo them. I underwent an autologous stem cell transplant, an extremely expensive procedure. At the time, it was not covered by my insurance. And my oncologist helped me get it covered, granted my portion of it, still quite expensive, but newly diagnosed cancer patients and survivors must understand the financial toxicity of a cancer diagnosis, and caregivers as well. The People Beating Cancer Lung Cancer Coaching Program is available either in the basic version or the premium version. The basic version is all 15 guides, as well as my ebook, Managing Cancer. The two work in tandem. The premium lung cancer coaching program is all 15 guides, again, my ebook, and 6 months of online support. Essentially, you and your caregivers probably will have many, many questions to ask about issues large and small. And I welcome you to ask me questions. I don't pretend to have all the answers, but I can sure find them for you. And I know what questions to ask you, in addition to providing evidence-based information to answer your questions. So, most importantly, the lung cancer coaching program comes with a 30-day money-back guarantee. If you're dissatisfied with the lung cancer coaching program for any reason, your money will be refunded, no questions asked. That doesn't happen very often, but once in a great while, someone will ask for their money back, and it's as easy as turning off the charge of your credit card, and we can do that. The lung cancer coaching program is a lot of information. It's, as I say, 115 evidence-based studies to support your cancer experience. It's a lot, but it's important information for you to have. Last but not least, you will be asked for a cancer code. You will be given a $100 discount The cancer code is the word webinar. Simply type in WEB webinar, WEBINAR, when you're asked on the checkout page. I think I've covered everything. Feel free to email me at People Beating Cancer if you have any questions. Good luck, and I look forward to working with you. Thank you very much.